All right, now McMurray's test. Is there, can I use somebody else that has their knees exposed so I can do somebody that's wearing shorts that wants to volunteer? So now, here is the joint line at the knee, right? You can feel here's the tibial plateaus, here's the femoral condyle, that's where they kind of come together. And then, like I said, if you're coming back from here, you can palpate, here's the medial collateral ligament. So, the ways that we're going to stress the medial meniscus is to externally rotate and also valgus stress. And I want to be able to palpate on that joint line at the meniscus while I'm doing the test. Now, everybody's may have slight variations with the way that you're going to hold your hand position, but what's usually going to work best is that I'm going to be able to use the heel of my hand to push into a valgus stress test, and then I'm going to be able to use this finger or maybe the two fingers here to palpate on the knee joint line. And then I'm either going to hold this like this, or you could hold it like this, because I want to be able, or kind of coming in across like so. So what I want to do is I'm pushing this way, and I'm externally rotating, and I'm extending at the same time. Okay? So like I said before, just when we talked about the meniscus, the way to stress the medial meniscus is to do valgus and external rotation. It's the same kind of idea before with these other ones. Whatever you're bringing more towards the front is the part that you're stressing. So I'm stressing this here by externally rotating and then applying a valgus force, and then I'm extending. Meanwhile, I'm putting that valgus stress on there, and I'm feeling here on the knee. Another way of doing it is like this, but again, you're going to need a bigger hand to do it like that, to get all the way over here. Usually you're going to be able to hold over the top of it, like that.
So where your fingers, you're feeling for
I can palpate there for tenderness, I can feel for some popping, because I want to be on the meniscus, as that's what I'm checking. All right, and then the other way, I'm going to be doing varus. So I'm using these fingers here to pull across this way, and then I'm palpating with my thumb. And I'll come over and do it on the other side of this. So valgus, internal rotation, like that. Okay. Gets a little bit tricky, but if you just keep in mind the things that you need to do to stress the medial meniscus, you need valgus and external rotation. To stress the lateral meniscus, you need varus and internal rotation. So then we'll repeat it on the other side. So I'm doing external rotation, valgus, and I'm checking on the medial joint line here. And then here, I'm doing it the other way. This time I'm doing it with my hand underneath. It's a little bit harder if your hands are smaller. But now I'm checking the lateral meniscus. I'm doing varus stress, and I'm extending. So I could also do it this way. So there's more than one way to put your hand on the knee and also on the ankle. Just remember what you want to be doing. For the medial meniscus, you're going to do external rotation and valgus. For the lateral meniscus, you're going to do internal rotation and varus as you extend. Okay? So you're looking for locking or popping, or if you do that motion and their knees giving them pain or something, or they feel a symptom, and you say, is that the same thing that happens when your knee bothers you? Because what you're doing is you're trying to reproduce the problem that they have in the knee. So then the bounce home test. What I'll usually do is stabilize on the back side of the knee, because if you just go like this, it's just going to, it can tend to, if somebody has problems with hyperextension, it's just going to go right into hyperextension. Because a lot of times, though, you know, if you know somebody, you suspect a meniscus or a substantial knee problem with swelling, you're going to be able to see the swelling already. So you could just do it like this, where I'm backing it up a little bit just to stop it from hyperextending. But what you're looking for is that it's going to bounce back. And it's not because of a muscle contraction, it's more because of a physical blockage where that keeps the knee from extending. Like if you have swelling, it's going to stop it from going into extension, or it's going to bounce back. If there's a loose body inside of it, it's going to push it back into flexion. And so then this patellar grinding or Clark's test, what you're doing is you're taking the web of your hand and you're pushing down like this. And then what you want the patient to do is to contract this muscle, and like you can see what he's doing there is it's pulling the kneecap up. Okay? And you may want to start out easy with it, and if you suspect, if you're pretty sure that the patient has some patellar issues, that you want them to start out slow, because if they do have issues, they're going to feel it, and it's not going to feel good. So you're pressing kind of not quite straight down, not quite straight this way, sort of at an angle like that, to try to press the patella into the femoral condyles. And then you're having them contract and pull up like that. And then this medial patellar spica, you're just pushing the kneecap. You're putting your hand underneath to flex the knee a little bit, and then you're just pushing the patella here and checking on the medial surface. That's where you have that plica. And then again, when we're talking about palpating the patella, you can push it medially and palpate that medial surface on the underneath, and then laterally you can kind of get underneath on the lateral side. That's not part of that test, but that's the patellar palpation. And then the Fairbake's apprehension, we've already had that demonstrated. Basically, you're trying to push the patella laterally. It's the same kind of thing with the shoulder. If somebody has that reoccurring problem, they're going to know that sensation and they're going to try to guard against it. So basically, you're just pushing the patella laterally, either in a flex position or, in a neutral position or in a flex position. And then this no-bow compression is going to be right on that lateral femoral condyle. And then you're going to be pressing on that spot, and you're going to extend the knee. When you get to about 30 degrees, that's when you're going to feel that popping. And you'll ask the patient, is that where your knee bothers you? Is that where you get the popping and locking? Or not locking, but irritation, tenderness. So right about there. And then the Wilson's test, everybody's sitting, you basically can do that yourself. What you're doing is you extend the knee, and then if it's in internal rotation, they're going to feel the pain, and then when you externally rotate, then the pain goes away. And that might be, is that the one that's on the extra handout? Okay, so just put that into your notes or just go over that one. Basically, if you remember, that was the one where they have the problem is on the medial femoral condyle, more specifically the lateral part of it. When you externally rotate, that takes the strain off of that part of the knee. So if they feel the pain when it's internally rotated, and they externally rotate and it goes away, that's more of an indication. Plus also the location of the pain is going to be deep inside of the knee. And so what we'll do is we can practice these tests. If anybody wants to get out of the table, they're unlocked. If you want to come up and use that one.